Hello and welcome to another episode of Kerakonnect. And this time we are here with an episode on anterior segment photography and videography. Sometime back, I was asking Praveen that what would be the next Kerakonnect as Praveen decides about, coordinates about the topics. And he didn't even think for a second. He said, you know what, the best topic would be, let's discuss about anterior segment photography, videography, and many other things. And we didn't have to think about any further. We both in unison said, well, who best can be the host than Dr. Nikhil Gokhale? Dr. Nikhil Gokhale is an avid photographer and not only an enthusiastic photographer about the ophthalmology, but beyond ophthalmology, his photographs are just eye-catching and beautiful. So here we have a wonderful webinar waiting for us, and over to Nikhil for the rest.
Thank you, Himanshu. I welcome all of you who are on this panel, as well as all faculty and all who are attending today on the YouTube, Facebook, as well as on this Zoom platform. So about photography, we have a session today where we'll be discussing a little bit more about slit lamp photography and videography. And I think this is an area where we all face troubles when we start our own practice. When we leave an institute and start working in our own clinic, we realize that we have problems of acquiring and trying to do what we did earlier in our own institutional setups where things were much more easier. And we have a very good faculty today who will be speaking to us. I'll just share my screen. So as you have already seen the topics, I'll try to introduce the speakers today in the order of their talks. We have Dr. Deepak Megur, who will be speaking first. As we all know, he is the head of cataract and glaucoma department at the Megur Eye Center in Karnataka. He specializes in complex cataract surgeries, and he's really interested in teaching, sharing, and learning. And for this, he has his own website and YouTube channel. He has a lot of presentations nationally and internationally. And as you can see below, he has had several Best Video Awards, Best Paper Awards in several conferences over the last 10 years or 20 years, as you can see. Our next speaker today is Dr. Vineet Joshi, who is a consultant at LV Prasad in cornea anterior segment. He is interested in cataract, corneal, lamellar, and refractive surgeries. And he is a lead in the Center for Innovation at LV Prasad and also a PhD scholar at IIT Hyderabad in the biomedical engineering. We have Dr. Pranish with us, who is a fellow from Shankar Netralaya, who is presently working in Eye Foundation. Again, has several papers in national and international conferences and has won photo contests in AIOS and our own Kerakonnect. We have Dr. Shweta, who is a professor in Minto Ophthalmic Hospital in Bangalore, where she also did her post-graduation and cornea fellowship. She has interests in microbial keratitis, lamellar surgeries, and also in photography and teaching photography to residents. We also have Mr. Sanjay Anand with us, who is a BE MBA in marketing. He has been working with Baliwala and Homi since 1996 when he started off, and he has experience in phaco machines, fundus cameras, and ultrasound, and is a proprietor of Ushma Technologies, and he designs surgical instruments also in association with Baliwala and Epsilon Eye Care. We have Dr. Satish Sheth with us today, who is working with Drishti Eye Care and Research Center in Hubli. As you can see, he was awarded the Best Research Award by Karnataka Ophthalmic Society by Dr. Rohit Shetty in 2019. He has won the Best Innovation as well as Best Video Awards at several International Society of Small Incision Cataract Surgery meetings. And he also has Best Video and Paper Awards at the Karnataka Ophthalmic Society. So before I start, I thought I will just share with you, we had a little bit of a small survey, and we also looked at some of the questions which our members would wanted to know and learn from this Kerakonnect. So I'll quickly go through it and then we'll start with the talks. So most of us do slit lamp photography, and a very wide percentage, 45 or 46% of us use a photo slit lamp. One of the question was that how do I decide which photo slit lamp should I buy, or should I use a phone camera? And I thought some of the issues that could be possibly discussed could be the cost of the system, space required, image quality, the learning curve that is there, the archival options, the EMR linkage, and whether you're working solo or in an institutional setup. There is also a wide variety of companies who manufacture photo slit lamps. And again, it's a question on how to decide which one to buy. And of course, you also need to look at the cost, the upgrade cost, the presence of software, and the after sale service, and the equipment life, and whether repairs are possible or not. A large percentage of us, more than half of us, have problems with the archival, and I think we are just sorting and naming files manually into folders, which is quite cumbersome, as we all know. And another question which Dr. Vikas had shared was that he has a Hagstride slit lamp imaging system which cannot connect to the cloud. And what do we do if the hard disk gets crashed? And how can we make it possible for these images to be sort of archived in a way that they are safe and maybe they can be put on the cloud? So this was again one of the questions that I got. Video display systems on slit lamp, only about half of us have access to it. Some of the questions that I received were that if you put a beam splitter, all slit lamps can't have a beam splitter, and if you do put a slit lamp beam splitter, does it reduce the resolution for your examination purposes? And can it be done on your regular slit lamp, or you need a dedicated system? And whether all photo slit lamps also provide a video option, or is it optional? Videography, as you can see, still about 39% of us don't have a videography system on our microscope. Possibly, I thought cost may be a barrier, so we should look at how we can indigenize it and try to sort of do it at a lower cost, which is affordable to most of us. And again, there are so many options of cameras which can be really confusing. Of course, the budgets may be different, but the requirements may be different. So how do we decide what is good for us? So I think these are some of the questions that we look forward to today to answer. And I would request all of you to please put in your questions, which I'm sure our panelists and faculty will make an attempt to answer them so that, we are better off at the end of the day. And this was another question put forward, that the videos are so big in size, how do we archive them? And is there a way we can compress videos without losing much of quality? And how do we edit them? And these are some of the questions. Again, many of us are not comfortable with editing videos, though we are not going to cover it today. Maybe in subsequent meeting, we could look at some of the shortcomings that we are not having time to discuss today. We could put them across and have another Kerakonnect where we could possibly discuss them. So I would stop share here, and I would request the first speaker, Dr. Meghur today, who is going to speak to us on basics of slit lamp for basics of photography, first of all, for the ophthalmologist. So I think as ophthalmologists, we need to understand about the basic concepts so that we can employ them in our practice. Thank you. Welcome, sir.
Thank you, Akhil, for the opportunity. Thank you, Kerakon, for the opportunity. I'll be speaking something very basic today because I think most of the ophthalmologists are interested in buying the camera, but I really find them lacking in the understanding of certain basic photography principles. So this is the most common question which I always have been asked: what camera you have? Because they believe that once you buy the best camera, it does the job for you. You can sleep around when the best camera is going to take the best photographs for you. But unfortunately, that's not true. The camera gear is probably not the most important thing you can buy. There are other things which are important, which we need to learn. The most important aspect would be to training our eye to identify a good image. That is the basic problem. We don't know how a good image should look like unless and until we are trained to read it. We'll always be finding and struggling with the thing. So these are the four important critical components of a good image. It should be very well focused. The composition has to be excellent. It should be appropriately exposed. And of course, the color and the sharpness has to be adequate. This is what is the main issue. And most of the eyes they are lacking to understand these aspects of it. Basically, photography is just playing with light. So you're writing with light, that's all it is. So we need to understand this basic concept. And the most difficult aspect of all the photography is try to understand the exposure part. And before I show the eye photographs, let me take you through the simple concept. What we would always want to have is an exposure which is standard, that is the one in the center part of the image here. If it is slightly darker, we call it underexposed. It is more than what it is required. It's called overexposure. It's increased exposure. So we have settings in the cameras which can decrease or increase the exposure, and we can alter them. Similarly, you can see the central portion, the central photograph is the one which is ideally exposed. The one which is dark, we call it underexposed. And the overexposed photograph, we can't see the details in the sky and the details in the building. They're all washed off. So it's important for us to understand what is the right exposure and what is underexposed. Most of the photographs which we see are extremely underexposed because the camera which we are using don't get enough light. And that's the reason the photographs appear as dull and washed out. The other two important aspects of focus and composition, this can be helped by using a large monitor. Even if you're using a slit lamp photography tool, having a large monitor helps us to nail the focus and compose it well, because most of us are now into presbyopia and trying to focus on a smartphone can be slightly taxing for us. This having a large monitor is probably the best investment both for your surgical video recording as well as slit lamp videos, to ensure that what your footage you're capturing is actually well lit and well focused and is composed well. And again, always ensure that the object of interest which you want to highlight is at the center of the field, so which actually grasps the attention. So let us go through a few images and try to analyze or read these images. And I'll be speaking something about understanding the image exposure through a few of the clippings. And this is one of the video clipping one of my colleagues and said to me to rate it. And if you just in a casual viewing, it looks okay. But if you look at it, it looks slightly dull and it's dimly lit. One of the most important aspects is it's not very well lit. We can't see the iris details very well. The rhexis margin is almost seen well. It's not sharp enough though. And the conjunctival results are all right. This is photographed in a retroillumination mode. We have got excellent red glow, but the detail and the sharpness of the iris and other surfaces not see. On the contrast, we can have another picture which is looks very sharp, and it is just when you look at it, it looks brighter. The exposure looks all right. And when you try to look for overexposure, try to look at the conjunctiva. Is it any overexposed? Because that's the white part of the image. It has a tendency to overexpose. It doesn't, and the details in the conjunctiva are still retrieved, and it looks optimally colored, well color balanced, and the contrast is there. Contrast is quite sharp here. So this is an ideal exposure. Now, when we look them side by side, it's very striking for us to see that the difference in exposure. This is appropriately exposed. That's the reason why you are having a bright image, a sharp image. The contrast is right. This image is washed off. You have the colors are dull, its image is underexposed, and as we can see, there's hardly any contrast here. So understand until, can we, the next question is, can we improve the image by using editing? We can do it. Now this is after editing, but it's marginally improved. You can see that the rhexis margin have made it more sharper. The iris details have been exposed, made a little bit more brighter. But still, the overall muddy appearance or washed off appearance continues to be there. I hope that through the YouTube compression, I'm playing it through YouTube, but the details are still visible enough. So what is the remedy whenever we have an image which is underexposed? The first thing is, if our eye can read it and detect it's underexposed, what are the things which you can do? The simplest and the most important thing to do is add more light. Most cameras are hungry for light. Most camera sensors are hungry for light. Add more light. How do you add more light? Increasing the illumination of the microscope, or switching the beam splitter to a better beam splitter, maybe 50-50, to add more light. And if you're overexposed, then you can reduce the light. Overexposure is usually not an issue for most of us because we're using beam splitter. And if you actually peep in through the beam splitter and see with the naked eyes, when we use an 80-20 beam splitter adapter, the light which is coming is very, very significantly less. So let me take you to an example of a very poor image. Although image is very well lit here, but there are areas where some of the areas are overexposed, they're not focused. The focus is on the conjunctival vessels up here. So in this situation, we can't retrieve the image at all. It's gone forever. Now this is very well focused, very well exposed. But on the contrary, you can say some portion of the field is overexposed. Now this is the blade. I'm not able to see the incision. If I want to highlight the incision, it is gone. We can't retrieve this amount of overexposure even in the post-editing process. So it's important that we need to be absolutely very well focused when you're trying to capture the image. This is an image, it's blurry, it's out of focus, overexposed, details are missing, and no amount of editing in the post is going to retrieve back any of the detail. So it's extremely critical that when we shoot, get the image right. Now, this is an image which is very well centered, looks very well exposed. The problem is it's still blurry because the rexus margin is not so clear at all. The reason is the focusing is not very sharp. So these are small things which make an image good or bad. Now let me look at one of the given example of probably a perfect image, how it should be. Let me pause here. You can see the architecture of all the limbal vessels, paralimbal vessels, everything is so clean. And you can in fact see the incision being made. The details of the blade are also seen. Of course, the iris details and the capsule details are all very well. So the most important thing apart from the focus is the exposure has to be right here. If the exposure is right, then we can try to edit a little bit better and make the image look much more sharper. You can add a little bit contrast to make it look even better. But if the exposure is not good when you're capturing, then rarely we can really improve the image quality. So the first take-home message here is that capture it in the best when you're trying to do it. Ensure that you're seeing well and the camera is seeing well. I'm just trying to show that all the aspects. Now this is a very high contrasty image. What I mean by, we've got a dark area, that is the iris, and we've got a very white area, that is the conjunctiva. So cameras have a problem in capturing these highly contrast areas, and you have a white cataract here. But if your exposure is right and you've worked on it, then you can see that both the brightest part of the image and the darkest part of the image are very well exposed. And that's the reason why most of the parts of the image are, look sharp. Now, this is an area, that blade, if the exposure was not right for that particular blade, but you can see this in this, the details of the blade and the incisions are crystal clear. Both were using the same camera, same microscope, everything. If you're not conscious when you're trying to photograph, this is almost technical things. If you're not conscious, then you can miss out on the things. Now, this is a slit lamp video. Again, if the focusing is not right, then you'll miss it. Then this is again the same patient, same eye, same slit lamp, same camera. The difference is enormous. So the message here is always try to capture in the best possible way and use the tools which are available. Like, try to ensure that you have a display monitor which can see. Now, this is a part which is overexposed, but if this is the overexposure is in a limit, we can use the software to reduce that part of exposure and make it, you can retrieve some data or detail into it. Now, in this case, I can reduce the exposure only in that particular quadrant, and the details of the blade have come back now. So this is possible only to in a certain amount of thing. You can't, an extremely overexposed image, you can't retrieve back the details. This is another case in a contrast image. I want to show the calcific plaque, but because it is so white, the details are lost. The exposure, I have an exposure issue here. So what I do is I reduce the exposure so that illumination is turned down. Now what I can see, the details of the plaque are seen, but the iris details have gone off. So some area is extremely underexposed, some area is having reasonably good exposure. We can correct this image using software, although to a little extent, not dramatically, but some amount of retrieval can be done. But the take-home message here is try to expose for the brightest part, so that always the underexposed part can be, you can expose it higher, but extremely difficult to get back the overexposed part. This is again a most common thing, poor image quality. Can we improve the image quality in post? The take-home message is no, you can't really, barely make a difference. You can add
What makes a good video? It has to be.
And before I conclude, I just want to share with you the system which I use for, to ensure that the focus, centration, and composition is good. Now, one of my fellows is operating. You can see it's the same microscope and the same camera, but just it's totally out of focus. The field is not well centered, and you can't blame the system for that. Although the surgeon would be able to see through the peripheral part of the vision, but the camera won't be seeing this. So to ensure this, I think the system which we use is, I have a large monitor which is at the foot end of the table. And the duty of the scrub assistant is always to tell me that, I'm whether off center or not, whether it is focused or not, because especially when you're using large sensor cameras, Even a micron variation in the depth will change the focus. Now you can see the focus is on the tip here, and the drape, the lid margins are all out of focus. This is especially true when you're using a large sensor camera. So you should be absolutely concentrated on whether your focus is right or not. And even the central portion is out of focus, the rexus is out of focus. On the contrary, the drape is focus. I think that was it. Thank you for
Thank you, Dr. Megor. And I think Dr. Radhika Natarajan has posted a question. How do you ensure that you are focused at the conjunctiva as well as inside the eye at the same time? So I think basically on depth of field or depth of focus, whatever you may call it.
I think most of the cameras which we use, we can get a reasonable focus even in the deep anterior chamber as well in the conjunctiva. But especially in deep myopic eyes where the chamber is extremely deep, in those situations, I think you have to forget about the conjunctiva and focus on where the action is. So suppose you want to show your phaco-tip or the rexus, don't bother about the conjunctiva much, even if it's out of focus, but try to focus on the area of interest which you would want to highlight.
We can go to the next talk and we can keep
Just
having the
Nikhil,
questions. Yeah. Yes, sir.
Just one
Yes.
point. The other
Yes.
way of reducing this, not getting in focus is not to operate at very high magnification. The higher the magnification, more the difficulty in maintaining the focus. So if you reduce the zoom, you achieve two things. One is that you continue to get better focus. And the second thing is even the centration, even if your surgical field is little decentered, later on, when you're editing the video, you can crop it and still achieve a central.
Right.
Yeah,
very often I think when we are stressed, we operate at very high zoom, and sometimes later you realize your key step is not seen in the video when you start editing, and then
correct.
you have no option to do that.
So this I learned from Donald Tan, because he has excellent surgical videos. When I asked him, he says, I don't operate at very high zoom so that I don't miss out any part of it. So he is able to, later on crop that periphery and still get the area of interest, which always looks as if the video is very well centered.
True. So we'll go to the next talk, Dr. Vineet Joshi. Since he's here, he was a bit busy in the OT, but he is going to talk to us on a Grabby, an adapter and a software, which I think LV Prasad is developing, or they're using it now, and how we can probably also make use of this system.
Thank you, Dr. Nikhil. Thank you, CSI, for this opportunity. What we came up with during the last 2 years is something trying to, work towards a solution which almost everyone has been trying in their backyard, in their own clinics, with experimenting with their own phones, focus, zoom, illumination, and try and get a good image using whatever the resolution of your smartphone camera is. And we try to simplify this complex problem so that it will become kind of universal, not just to us, but also to patients. But today I'm going to highlight its use for us doctors as well. But briefly, I'll just touch on 2 minutes on what exactly we did for the patients. So in the last during the first lockdown, the patients were sending images from their smartphones, and as you can see, the main areas of problem were the lack of focus or the shake which used to be there, and basically lack of patients' knowledge on understanding what is the main frame of interest for a doctor to understand or make a clinical decision. Again, lack of standard lighting, and also poor magnification. Poor magnification means if you zoom that image, it will pixel out. Means if you see the images in the last row, like the last image, you might still say that there's some clarity, but the moment you zoom it in, it will pixel out. And in because of the a lot of problems because of mechanical stability or the gap between when the patient clicks on the smartphone screen and when the actual image is captured. And all these things vary on different handsets and different mobile phones. And so there is a huge variation. So mostly our smartphone cameras are not.
We can't hear you very clearly, Vineet, I think.
Okay. Is it audible clear right now?
Yes,
Yes,
Vineet, we can
Is it
hear.
better now? I'll keep
Yes.
my video off and I'll continue.
No, I think there's some interface. This thing, I think maybe your headphone or something is creating issue.
Okay. Is this better now?
Oh, perfect. This is much better.
Okay. So, so the smartphones are basically tuned for distant photography. Now, in distant photography, the lenses, the optics, the focus, and the inherent software of any smartphone, so which is basically tuned for sceneries and different modes and other macro modes. And nowadays a lot of new additions are there in like night modes and everything. So a lot of intuitive softwares and internal algorithms are in place, which is already connected to the hardware for a particular specific purpose, but not for ophthalmic photography, which is different than macro photography. Add to that the problem of so many different smartphones, and then you have a big problem at hand. So what we focused on patients was that if you give a very simple solution, like give them a hardware which is universal, can fit on any smartphone of any price range, with a focal distance of the length of which is such that it is calibrated to most of the focal distance of the camera, and couple it with an app which can help standardize the other parameters of magnification, lighting, and also the focus. You can utilize the innate software of the smartphone to capture good images of the eye. And this we tried to bring in some intuitive concept into it, by how it will be easier for the patients. Like they have to just put in the device, start the app, and just tap on the screen, and they'll be able to get a good image of the anterior segment, which is good enough for teleconsultations, so that you can do triage. Like you can actually find out which are high risk patients, need to early referrals, or for your post-op patients, and look at them if there is any problem or infections. And this is how you will see. This is captured using a Samsung A series phone, and the app stores the images on your image gallery, and you can share it with whichever way you want. The best part is the app stores the time and the date and the name. Everything is it's put as a mark on the image, and that gives easier for the doctors to follow. Some of the patients who have captured it, some of them sent videos from their home, and it is pretty effective. And we found that some of the patients in Jammu Kashmir after PK were also able to communicate with us with good clarity of images. So on the left hand side is captured just without any device, using plain smartphone, and on the right hand side is using the app and the hardware. Now we try to think of it a little bit further with the perspective of doctors. Now what do clinicians or caregivers need? They need even more clarity. They need clinical documentation. We need to capture even more features, as Dr. Deepak just mentioned. We have to capture more features in more depth, which is where a macro lens comes into the picture. And this has been attempted in the past by 4 different companies in 4 different countries, in Canada, in China, in Japan, in New Zealand. What happens is, when you put a macro lens and you try to design a structure around it, it kind of becomes unique to that particular handset. So if you see the third one, which is the latest one from Japan, the Japanese group tried to use the flash of the smartphone camera and use a macro lens. But then the arrangement of the camera and the flash was such that it could be used only for iPhone 7s. Similarly, a problem with the quick view, where again its design is such that it will fit on the camera only in that location. But we have, so the universality becomes a problem when you try to target these kind of designs. So we tried to build, and these are just renders, these are not final modules. Where what we tried to do is we built a macro lens with a standard illumination, warm light, as well as blue light, and blue light for fluorescent imaging. And we tried to see if this will help clinicians. Now, this is a pocket device. And what it basically does is that it can capture, it has got a headrest, it has got a cheek rest, and what it basically does is it gives a very good magnification and a stable and standard illumination. The quality of image is better than the one that we designed for the patients, and it is equivalent to a portable slit lamp. And this being absolutely a very simple and effective tool which can fit in anybody's pocket, you can carry it anywhere that you want to go and it will fit on your phone. It's like a clinic in your pocket. You can examine the patient wherever you are. If you are rotating private clinics, if you are traveling anywhere, if you want to examine patient, or if you have gone back to your village, you want to see your relatives, you don't need a slit lamp. You can directly do that. It is like diffuse photography without a slit, but the quality of slit lamp. Plus the addition of blue light is actually what we were trying to see if it can help. Now, this is one of the image which I captured last week, and you can see this is using my smartphone and this Grabby Pro device. You can see each and every vessel that has been growing into the graph. You can see the loose suture at 1 o'clock. And not just that, you can also shoot 10-second videos. And that is what we thought is very unique, where you can actually shoot reels and you can ask the patient to move the eye, which can actually capture more information. And if you're able to do that, or if not just clinicians, if anyone at the periphery, any optometrist is able to do that, you can capture a lot of more information. So what we were thinking is it can be also used for distance education. Like if you have fellows or students in some peripheral centers, they can actually do that, show your post-op cases to you, and you can actually give them opinions regarding the same. Now, I'll get to what it does. And these were some of the images, the first initial images where we tried to document and we got encouraging results. And now I'll just show you head-to-head comparison. Like if you capture an image just with the smartphone, and this is with Grabby Pro device. So a lot of difference, a lot of confidence that it gave us, and to any clinician when they see the same image of the same eye with the same phone with just addition of this pocket device. And it's very easy. It's you just have to put in front of the lens, which is the acting camera, because nowadays there are multiple cameras for all the smartphones. You just put it in, and you switch on the lights, and the rest all it captures by itself. You can actually see that it shows the even intricate details within a scar and even the iris details. So some of the anterior segment images that we captured using this are very good, and it shows every detailed feature. Like in this one, post PK cataract and also loose suture at 7 o'clock. And in some of the images where we tried to capture nodular scleritis and even conjunctivitis, if you zoom and see, you can actually make out the small papillae very clearly. So it's very good for clinical documentation. And this is where we tried to use it in fluorescent stained using the blue lights. So we shot those 10-second reels using the same. And this kind of information was very good in our contact lens clinic when we did the contact lens fitting for some of the patients. And this was good enough. And many of them suggested that this use is far more simpler and easier and less troublesome than making the patient sit on a slit lamp and then document the whole thing. And the best part is, instead of the whole media format going into the computer and then you transferring it back to your wherever you want to share, this gets recorded directly on your phone, ready to share wherever, whenever you want. So these are some of the epithelial defects that were we captured using the same device. These are some 10-second reels of for a few of my post-op patients. So you can actually do like Instagram, you can label them and for educational purpose, and you can keep them with you. You can zoom, you can ask the patient to look up and down. It's a very good format of documentation. What we felt is, so this is one of the patient of Tenon's patch graft on the left side post-op day 1. On the right side is a HSV necrotizing stromal keratitis. So pretty good quality. Like you can actually, the best part is you can get customize it to your requirement whenever you want, and it's very easy. Something unique which we tried was doing a live video call, and even this was pretty clear, and I was pretty much happy with its quality of image. This is over a live video call, and even that works pretty well. Talk about convenience, like patients who are in wheelchair, who cannot it's difficult for them to keep their chin on a slit lamp. You can directly go put this on your phone and capture the image, and you can get the details pretty well. We tried this in some of the patients of Down syndrome kids who were having difficulty in cooperating. We handed it over to their parents, and we were able to capture those images very clearly. So this was just at the outset. What I wanted to highlight is where we can go ahead with smartphone photography, and it can help in standardizing clinical documentation and also make a job a lot easier for all the doctors.
Thank you, Vineet. That's really encouraging. Rajesh, your comments, like you do a lot of smartphone photography and you have beautiful images. So how do you look at this?
No, definitely. I think most of the points, it does not take too much to take good photographs using your smartphone. And I would say that I've been using the smartphone for taking photographs right from iPhone 4. And even now with what you have, the recent iPhones, which have even better capabilities, you can take very good photographs even without the need for a external macro lens. The only thing you need is you need an external light so that the camera can focus very well. If the eye is dark or if there's not enough light, then it cannot focus. So you can have a diffuse light shining on the eye, and then using your camera, you can, the smartphone, you can click pretty good photographs. And most of the patients, we give them instructions that you please send us photographs. And people, whether they spend money elsewhere or not, but at least all of them, they spend good amount of money on a smartphone. So and they are pretty good at clicking photographs, so they do send us good images. And I think most of you, if we just spend a little bit of time in clicking photograph, as what Vineet has been showing, you'll be amazed to see what your phone can really click. You have some clip-on macro lenses which are available on Amazon. You can try getting some of them. Some of them have a very large lens, so it kind of covers. In fact, my iPhone 6, which only has a single lens, I find it useful because the macro lens covers that single. But now with most smartphones having 3 or 4 lenses, it becomes difficult because, for different distances, the different lenses become active. So you need to know where to put the macro lens to be able to focus when you're clicking those photographs. But it's pretty good actually, and you can airdrop, you can easily post from your smartphone, you can edit the video on your smartphone, so it's quite useful.
Dr. Basak, you'd like to say how you take award-winning pictures for us, if you are there?
Yes, I'm very much here. So basically, I do not use smartphone. We have actually the slit lamp camera system, and the main thing about photography, what Deepak said, that you have to look at which angle, not necessarily you have to go by the typical slit lamp examination system. All those are important, but you have to find other aspect, like what Rajesh said, you have to give extra light from external source. Sometimes this built-in flash also too much exposed. So you have to give external light with some kind of table lamp kind of thing. And then you see suddenly that your area of interest, you can show it beautifully. So that is why whichever camera you are using best, you have to play with the light and shade. Those are the two basic things of any photography. Of course, the color is there, focus is there, your composition is there, centering of the image is area of interest is there. So then the camera itself is not, it is important, but you do not have to go for the highest grade of camera. So, but you have to take the light exposure, both are important.
And you need to click multiple
Yes,
photographs.
of course.
Because often if you click 10 or 15, you will find one of them will be very
Only
sharp.
one, yes.
And the remaining will have some blurring, so you may miss out. You may think that earlier when we were using the film cameras, it used to be very difficult because only when it gets developed, you know whether your photograph is good or not. But with the digital cameras, you have an advantage that you can immediately see and retake a photograph if it is not up to your liking.
And the light of the room for the slit lamp camera, the room light is very important.
Off.
Where is your light source in that room? Any side light is coming or not? Any extra shadows are over the cornea? All are important. So then you can actually take a very good images and multiple images. What Rajesh said.
For your photo slit lamps, what you use, do you have to do any jugaad, or they just give you instantly good pictures? Or you have a learning curve and you have struggled to get better pictures, or how is it?
Photo slit lamp, no, you have to actually play with the camera and the slit lamp. So when you get a patient and you have time, you yourself do it. And technician will be your side. Then you teach the technician that you want this kind of picture from this particular disease or whatever you want to capture. So that way you learn. There is no ready-made. Unless you play with the system, you have to play like your smartphone. You are playing with the smartphone. So you have to play with the slit lamp one also. So whichever slit lamp system is you have, that is enough. But again, light, camera, and action, all are important thing.
True. It's like if you have a nasal pterygium and if you keep the light on the nasal side, then the light reflex will come on the pterygium and you won't be able to get a photograph of that. Then you have to put the light in the opposite quadrant so that there are no reflections on the pterygium, and then you are able to get a good photograph of. So you need to know. So the lesion that you are photographing, that should be seen very well in the photograph. You should not have any light reflex, anything that is making it difficult for you to see. And also, if you're taking a fluorescent dye, then don't stain before and then come for the photograph, because by the time the dye is diffused, you'll not be able to. So if you want to take a fluorescent, don't do anything. First get on slit lamp, everything, then you put the dye, take a photograph. Otherwise, by the time you decide to take it, everything, the dye would have diffused and you will not get sharp margins. So a little bit of planning is required. You need to know what magnification to take. And obviously you need a cooperative patient. Often I put a drop of anesthetic on the eye when I'm taking photographs, because that helps me, otherwise some patients are not able to keep the eyes open for a long period of time. They want to blink. So these are few tips that you have to do, when you're taking these photographs.
And a quick point, just photograph with a smartphone with a macro lens versus photographing the same eye using a slit lamp. Because you can't there's no other option. If you want a slit photograph, the camera has to go onto the slit lamp. There is no other option like that. So that is one distinct advantage of using the phone on the eyepiece of the slit lamp and then taking a photograph rather than using a macro lens. So there is no other alternative. If you want a slit photograph, you have to go to and use a slit lamp, whether it's a portable slit lamp or a regular slit lamp, and use a side torch for background illumination, and then use a stick on the slit beam, and then we get an image.
I think smartphone and this macro lenses all are very good for teleconsultation, very good for sharing the image with friends. But when you go into detail of the picture, then you lose it. But Rajesh has wonderful picture.
No, you can get very good photographs with that as well, connecting the iPhone or your phone to the slit lamp eyepiece. It just takes a little bit of practice and patience. There is a small learning curve. But if you do that, you can get fantastic photographs. Yes.
Exactly.
Dr. Basant sir, shall I interfere for a minute? Hello.
Yeah, Vinny.
Yeah,
Yes.
go ahead.
Sir, I would beg to differ on the smartphone photography because smartphone photograph, most of the time it occupies one of the oculars when the surgeon is viewing at a slit beam or something. So I would always prefer that it can be routed through a beam splitter and a C-mount system or a DSLR where you can get very excellent slit images because the surgeon is viewing through the binoculars and no need of any assistance from anybody, and you can capture very good quality images of slit lamp.
Yeah, that is that Rajesh was telling that one only, that if you fix it, but it needs your learning curve and adapter system. I think everyone has used some kind of adapter and ultimately they fed up with the system. I think what is Himanshu's opinion?
I think I'm spoiled with the institute background, so dedicated
Slit lamp photography.
But having said that, many times we have seen the smartphone photography can be more practical sitting in your room. You don't need to send the patient out or something. So it's a best of both worlds. If you know how to take good smartphone photography, along with you have a dedicated slit lamp camera would do the job for us.
Yeah,
Absolutely.
if you have a peripheral setup where your optometrist or some assistant is handling the patient, there it would be really helpful to capture the images on on a mobile phone and transfer it to the base hospital. But if you want to really document a really good quality picture, it should be either a photo slit lamp imaging system or a DSLR based system.
Actually, that is where we are trying to bridge that gap. And I think it's quite possible with the recent softwares, especially the newer iPhones have given us a lot of encouragement. And even the other phones, there is a way to bridge this gap. And I hope we'll be able to do it. And the macro lens really helps to get these fine features out and capture in the right aspect and ratio. So hope so we get it out there. In fact, one of the slit device on smartphone was tried by that Japanese group. They used a prism light along with the macro lens, and the prism was positioned on the flash of the camera. So that flashlight was converted into a slit, and using that they were capturing the images.
I think that's a good idea. That's an excellent idea.
Yeah, but then again that became your for only for iPhone 7. They can't use it on any other smartphone.
That is the problem.
Yes.
The good part of all these things is these things push our limits, and these things give us newer inventions. So keep it up, guys, and keep coming out with new things. We move on to our next speaker, Dr. Pranesh. Ravi will be making us smarter with his smarter tips on smartphone photography. Pranesh, over to you, please.
Thank you, sir. Thank you, Himanshu, sir, for the introduction. I would like to thank CSI and Nikhil, sir, for the opportunity. I'll share my screen, sir. Am I audible, sir?
Yes, you are, Pranesh, and your slides are visible.
Okay, thank you, sir. So today I'll just talk about tips for smarter smartphone photography. So the first tip I would like to give is to use a Google camera instead of a stock camera. As we know, in smartphone photography, the megapixels actually don't matter. It is the optics and the software which matters the most. The problem is that most people don't have a high-end phone, like an iPhone or a Samsung or a flagship phone for that matter. So most people have a random array of Android or iPhones, and the software in these phones and the optics aren't that great. So I wanted to bypass this, and I found an app called Gcam. So what Gcam does is it gives you excellent white balance and dynamic range. It has an inbuilt image stabilization, and it has a HDR enhancement option. So what HDR is, it's basically high dynamic range. So as our photographs usually have lots of light, and we need to capture all details properly. So what this basically does is it gives you exactly the granularity and the black and the whites of the photograph. And the best part about this is once the photograph is taken, it has a post-processing option, which the app does by itself. I'll just like to show you some samples of the photographs which I've taken. So on the left, you can see the image that I've taken using the stock camera, where you can see that I had taken the photograph of a lens. And in the cross section here, the patient is having a posterior subcapsular, which is not exceptionally visualized in the stock. But when you see the Jeep cam, it gives you the excellent quality and you're able to see the small posterior subcapsular cataract in the lens. Now coming here, it's a patient of HSV, keratitis epithelial, and in the stock, you can see on the blue filter, the images are not sharper. You're not able to see the appreciate the edges properly. And then here on the G-cam, the edges are very clearly visible. The green are brighter, and you can see the epithelial stippling and the granularity much more proficiently and perfectly. And this is a person who, girl who had come with the infiltrate. Here you can see the edges are much more faded and the size is not that appreciable and it looks a bit foggy. But when it comes to G-cam, the edges and the infiltrate are more pronounced and accurate. So this is another patient where I had to do a cut section of a cornea, where you can see in the stock, the image is a bit overexposed. You're not exactly able to assess the three-dimensional cut section of the cornea, but as far as G-cam is concerned, you're able to get a very clear image of the thickness of the cornea. And now I have, I did a BUT test for a patient, and here on the right side and left side, you can definitely markedly see the image difference of the fluorescence. And if you look at the edge here, you can see the G-cam has something which is called as an electronic image stabilization. So basically what it does is it electronically stabilizes the motion which you do with your hands, and it gives you a better picture stabilization. So next tip is usually what happens is people tend to clog the camera lens, the sapphire glass which they give, and the eyepiece with fingers. So usually you don't tend to realize why your quality isn't poor. So what I would like to suggest is this is something which you see, which I'd like to call the bleed sign, where the light bleeds out of the circumference of the eyepiece. So when you see this, this is a clear sign that the light is scattering over the opacities in the lens, and you get a poor quality image. And this is the same image after cleaning the oculars, and you're able to really appreciate the infiltrate here. The next thing I suggest is use shortcut buttons to take pictures. I don't use a mounting device to take my photographs. If you're having a Samsung phone in under shooting methods in this GIF as it's shown, you have an option where you can use voice commands to take photographs. It makes your life much easier. Or if you have a G-cam or any other stock cam, you can always use the volume down button to take pictures, so that you need not hold it with one hand and just press the click button, and it makes our lives much easier. So one more thing I would like to tell you is you can use polarizing filters. So once all your oculars are clean, everything is sorted out, you always tend to see that there's a lot of light, and it marks out all the features which you're supposed to see in a normal slit lamp when you're taking a photograph. So what a polarizer, the image shown here is a circular polarizer. There are usually two types of polarizers, a linear and a circular. The linear ones are exceptionally expensive. So I stuck on with the circular polarizer. These are quite cheap. They cost around 500 rupees to 600. And they help to control the glare and the haze that you get in the photographs, so that you're able to get exceptional picture detail in the photographs. Here with filter, you see a lot of details are lost, but when using a filter, you're able to see all the details are captured by my smartphone camera. And the filters are not always to the to-go device. You cannot use it in fluorescence, because here you can see a small epi defect with the fusion line, and this is not appreciated when you use a filter. So it will block out all the fluorescence. And next is the background illuminators are underrated. So whenever you're taking a photograph of something which is external, so when you're focusing a light at one point, what it happens is it light up that area, and the other areas will have a shadowing effect. So to avoid this, you can always use a background illuminator. So what it basically does is it will kind of give you a better contrast and delineation of all the vessels and the details of the anterior surface and the segment that you're going to take. So this is a mountable background illuminator. For instance, if you don't have a background illuminator attached with your slit lamp, you can buy this. And by maintaining the degree of 30 to 45 of background illumination, you can definitely get an excellent photograph. So this is about photo archiving. I usually use Google Keep for photo archiving. So these are all the photos that I've taken till now. So what I do is I just take a snapshot of the MRD number of the patients, and then I note it down and I write the names and my presumable diagnosis of what I think the patient is having, and I just archive them in Google Keep. The only thing is it's easily modifiable, but once you get a hang of it, then you will definitely able to archive the photos easier. So the biggest advantage of this photo archiving system is it's readily usable, so that for instance, if you're not having your laptop, or if you're at home and you need to retrieve some photographs for a talk, or if you go through Gmail or if you do Google Photos, you're not able to exactly watermark or earmark all these photographs, but Google Keep gives you an option to make it much easier for archiving your photos and retrieving them. This is based on the cloud service provided by Google. So all these photographs will cramp up the memory of your Google account. So that should be kept in mind. So next point is it's always better to go freehand, and adapters are too cumbersome. So what I've first shown you is the cheapest and a universal adapter, which most of the smartphone devices tend to fit in. But usually what happens with adapters is they're usually good for iPhones, but the one problem is they fail to solve was the phones keep on evolving, and the dimensions and the diagonal dimension of the phone tend to keep on increasing, or the phones have also become heavier. So these two aspects, the adapters haven't been able to address. Usually average person tends to change their phone every 2 years. So using an adapter, I've taken photographs, but I've never found it comfortable. So it is always better to go freehand, because it is very easy to take a photograph in your freehand, and you can also get a better quality pictures, because all the pictures I've shown in this presentation, I have never used an adapter. And this is a video of me taking a freehand photograph. You can exactly see I'm able to stick onto the ocular and focus the eye just within a matter of 4 seconds. So that's how much time you'll take, and you can look at the picture quality too. So one more tip I would like to give is it is always better to timestamp your images in your camera and in your phone app. The thing is that it's always, because you will never know, as far as cornea is concerned, you will never know when the infiltrate is scarring, the size of the infiltrate, and usually photographs helps us to document the process of lesion healing. So when you timestamp, you will exactly know at what date you have taken. People might say that it's always easier to retrieve this data through the details, because your phone by default, when you click a photograph, it'll by default, if your location access is active, it will take the location, the time, and the date when it was taken. But it's always, you need to go to the properties and then go look at it. But if you timestamp, it's always easier to look. And if you see, it's always on the lowermost end, so you're naturally going to edit these photographs, so it's not even going to matter if you're going to edit these photos. It's not going to block your photographs. So these are all the photographs I've taken. I usually always timestamp my photographs. And thank you for this opportunity. Thank you very much, sir.
Thank you, Pranesh. That was really nice.
Thank you.
One thing
you,
which comes as a question in my mind is that, Pranesh, when you say Gcam, does it mean it's an app which is available on Android, or it's available?
Yeah, Gcam is Google. It's made by Google, so it's only available for Android. I don't know any alternative for iPhones. But
okay.
Android has got a wide array of phones, and not all the phones have a good quality camera. So this will possibly address the issue. And also, I have not explained the process as how to install it, and it's easily, if you Google it, you will be able to get it, sir. So that will not be
So
an
it's
issue.
not, so you have to sort of side install it. It's not available on the Android
No,
market.
it's not available on the Play Store. No, it's not available on the Play Store. If people are interested, I'll just I'll tell you trusted websites where you can install it, sir. Or you can just go to YouTube and type how to install it, and on the description of the YouTube channel, they would have given you the website link, so it's easier to install.
So
Where to get the background illuminator, which you showed?
I got it on Amazon, sir.
What is it called? It's called background illuminator itself.
I don't.
What is it
I
called?
don't remember. It's
You can
purchase it. You can purchase it online, sir. You just have to
So
kind of
what is it
stick
called?
it to the.
Deepak, these will be like, for reading books or working on the computer laptop at night to
Yeah.
illuminate the
I
keyboard or to
tried
read.
that. I tried those. They were not very good, actually.
No, you'll have to try several of them. I
small
also bought a
slender
lot
ones.
of them.
Small slender ones. Yeah.
Yeah, so there are some which have flexible, arm
Yeah.
as well
Yeah.
with the LED. Yeah, so you can get that. You will have to sometimes put a little bit of diffuser in front because sometimes the light can be very bright. So I covered them with, butter paper and kind of
tissue
make it a
paper,
little bit more diffuse. Yeah, something like that.
But his
So-
was something different. He had some pocket device, something. What
No,
was
there is
it?
a commercial one also available from a company called TTI Medical. If you see that, I picked up one at AO, which can actually fit onto a slit lamp. The slit lamp, the central axis, where you can put your applanation tonometer, this fits into that. They charge about $100 for it. It has a small battery, but it gives you a light which is pretty much, what you would need for an external photograph. The other option is if you have an assistant in your clinic, they can take the indirect and shine it from a little distance, with a reduced illumination. That also gives you a very nice focus beam onto the eye. Maybe the ones which I have, I can share. I can give you some idea of what.
Sure. Because I tried many. So ultimately, we use the indirect light only. Ultimately, we use the same
Correct.
thing.
No, but there are other lights which work, which I can share with you. But most of them are LED based. So what happens is either the light is too diffuse or it's so bright that the patient becomes uncomfortable. So you then have to figure out a way to reduce that intensity.
You can use an ISO setting, sir, in the Pro. If you go to the
ProCam.
ProCam.
Yeah, that's on the iPhone.
Reduce the illumination.
iPhone. iPhone has the
most
same
cameras
software
have it.
No. I'm saying just like the native app you're talking about. On the iPhone, if you want, you can install something called the ProCam, which gives you the ability to modify. It's like a manual camera, so you can change the ISO settings. It does not run on the auto mode, so the white balance and the focus can also be separated. So what happens is those are more for if you understand photography and you are willing to play around with it. But the thing is, the newer phones which are there, they have already excellent imaging capabilities. And you can take good photographs. You are an expert in holding your phone to take on the eyepiece without shaking, but not everybody will be able to do that. But like phone specific adapters are there. The best one I've used is from a US company called iMagine, EYEMAGINE. But they made only for iPhone 4, 5, and 6. And after that, I think that startup didn't make any more. But if you can buy an iPhone 6 and use that, or iPhone 5 and use that, you can have excellent photographs which will match up to any photo slit lamp. And it's very stable on the eyepiece, and that gives your other hand free to be able to focus the slit lamp and ensure that your image is in perfect focus.
Sir, I have one question, sir. Fogla, sir, like the adapters have this tilting issue, sir. The phone.
No, this one doesn't tilt. This one holds your phone. It has a rubber cuff that you have to put onto the eyepiece, and this thing clamps on it. So then it doesn't rotate or it doesn't. It stays very stable.
Adapters have this tilting issue. They tend to tilt with regards to the weight. They tilt backward or forward.
Correct,
so that will.
Correct. So the other
that's the
thing
reason
is
why
to
I
have a
stopped
beam
using
splitter.
adapters. Okay.
And that's the reason I moved on to a photo slit lamp, because the archival was a problem. You mentioned about Google Keep. That's a good thing. Otherwise, when you take with the phone, you have to take a photograph of the patient. So end of the day, you have to go and do some work to be able to do that. There was a Chennai-based company that used to make this. They have an app in which you get, that's AmbleSoft, a company called AMBAL SOFT. They have an app in which you can enter the patient's details, and then you can transfer your photograph and you can archive it. So it's an archival, software, which is good. So if you're using your phone and you want a professional archival software, you can Google UmbleSoft and you can buy the software, and then you can have. The problem is you get one software with a USB stick, which you need to install in that laptop. That cannot be transferred anywhere else. So they are smart enough. So every license will have one USB stick. So you can't really use it on multiple devices unless you buy multiple licenses.
And one more thing I forgot to mention, sir. If you're planning on archival and you're not willing to type it out, you can just take photographs of the EMR, and there is an app called Evernote. So the best part about this app is it can search the letters in the images. So you just have to type out the letters in the search, and then it will just pop out. So it makes job much more simpler.
Good.
Where do you put the polarizing filter on the slit lamp?
In the front, sir. In front. Just like how we use a yellow filter on freehand, you just keep the polarizing filter, and then it'll. I think it'll have a 30 to reduction in glare, sir. I think, sir, if you want a much more higher quality, then you have to use a linear poly. It'll have two lenses, sir. You have to rotate it to control the.
Maybe we'll go to the next talk, which is trying to do endothelial photography with the smartphone. So I think that is a much more technically, I would think, a very difficult issue. Actually, trying to seeing the endothelium on the slit lamp took me probably 10 years to learn. And with the smartphone, Shweta is going to tell us how we can achieve that. So I'll hand it over to you.
Thank you, sir. I thank the Cornea Society of India and the organizers of Kerakonnect CME series, Dr. Nikhil sir. Thank you for this wonderful opportunity. Today I'll be speaking about how to photograph the endothelium by using a smartphone. There is no financial interest. India is already ranking number 2 in the number of smartphone users, and it is going to touch 1 billion by 2026. So the smartphone is ubiquitous. So the smartphone has found its application in healthcare, in the practice of evidence-based medicine, mobile clinical communication, patient education, and remote monitoring. And there are various smartphone applications in ophthalmology ranging from color vision, astigmatism, birds, dot, and patient education, visual aids, and various other research applications. Today we are going to explore another dimension of smartphone, that is taking the endothelial photograph with the help of a smartphone. So this endothelial evaluation is required in evaluation and management of endothelial dystrophies, and in preoperative evaluation in cataract surgery, and in cross-linking for thin corneas. With a growing interest in anterior segment photography, the possibility of photographing the endothelium was explored. So what are the requirements for endothelial photography? Basically, we need to have an interest in photography, and some experience in anterior segment photography will help a long way in photographing the endothelium. And as Dr. Nikhil said, one should be well versed in specular reflection. We should be able to see the endothelium at 16x and 25x on a regular basis so that we can photograph it. A cooperative subject or a patient is the utmost criteria, because at the beginning of taking photographs of the endothelium, we need to have a really good cooperative patient who can sit in front of the slit lamp for at least, if you're taking a videograph, sit for at least 1.5 minutes and cooperate. But majority of the patients or subjects did not complain of any problems except for neck pain if you photograph for more than 2 minutes. But otherwise, so initially you request your friendly colleagues or your hospital staff to be your subjects, and then start photographing the endothelium, start looking at the endothelium. And coming to the smartphone specifications, any regular smartphone with 16 megapixel rear camera and a minimum of 6 times digital magnification will serve the purpose. The smartphone what I have used here is a Samsung Galaxy M31, which costs around 15,000. Any regular smartphone will have these specifications, in fact, better specifications nowadays. So smartphone should not be a limitation. And access to a good slit lamp can be a limitation in some centers. A good slit lamp with a bright illumination and a good magnification of a minimum of 40x is required. To view the endothelium as a sheet of cells, a 16x or a 25x magnification will serve the purpose. But to look at greater details of the endothelium and to photograph the endothelium, a 40x magnification is desirable. And we can photograph it with or without an adapter. Basically, the technique. Once the patient is seated comfortably in front of the slit lamp, so change the angulation of the slit beam and the illumination beam. So the slit beam and angulation beam should be at 45 to 60 degrees to get a good specular reflection. Once the endothelium is focused at a lower magnification like 16x, change the magnification to 40x. So first view the endothelium at 16x or 25x and then change the magnification to 40x. So this is how we focus the endothelium. So follow the circle of light with your smartphone. The slit beam should be around 2 millimeter height and 1 to 1.5 millimeter wide. On the right side, you see the bulb filament, the reflection of the bulb filament of the bulb. And on the left side is the slit beam. So the slit beam is only very short, aligned in such a way that it just goes just next to the filament of the bulb. And then once the endothelium is focused, and increase the magnification. All this while the smartphone was held handheld. Of course, definitely an adapter can be used to reduce the shakes, but once we get used to it, we can hold it in with hand. So you can either take a video or take a photograph. If the video, one need not worry even if the video is shaky, because with such a good editing softwares, we can take frames of that video and consider them as photographs. So this is how the endothelium looks once we focus on it. So the filament of the bulb we can see, and we can see the sheet of hexagonal cells, the beautiful sheet of hexagonal cells. This was from a patient who had previous intraocular, 2 or 3 intraocular surgeries, but the cornea was still clear with a low endothelial cell count. So this was from a patient, young patient with a healthy endothelium. This was a 12-year-old girl with keratoconus. So they can see the number of cells there, the size of cells there. So this was a picture which was shot with the smartphone. This is an unedited photograph. We can definitely use many editing apps or like Snapseed or Adobe Photoshop to make grayscale conversion or border augmentation or sharpen the borders. So this is a case of polymagatism seen in Fuchs endothelial dystrophy. And this is a young healthy endothelium, Gutte in Fuchs endothelial dystrophy, where the cornea was hazy. So the endothelium per se could not be photographed in this case. We could only photograph the Gutte. So various slit lamps were also used. The earlier photographs and video were from Carl Zeiss 5-step slit lamp with 40x magnification. And this is from Topcon slit lamp with 40x magnification. And all the shutter speed and ISO changings were all auto settings. There were no manual settings. But just for the sake of information, the ISO settings was between 25 to 50. And the shutter speed was from 1/50 to 1/100. And the aperture of the lens was 5.23 millimeters. So it is less than the macro lens. So it is the main camera of the Samsung Galaxy. So and recently started using the adapter because any technique which is not widely used should be reproducible. So we started using the adapter also so that more and more people can use it. This is just a universal, adapter, not anything which is specific to Samsung phone. So this was with the same slit lamp, but with a different shutter speed. It was 1/100 with the call size with the adapter, and on the right hand side, the shutter speed is 1/50. On the right hand side, we can see the clear borders of the endothelial cells, the regular hexagonality of the endothelial cells. So this is a comparison image of the endothelial photograph and the specular microscope photograph of the same patient. We can see there is a reduced count with an enlarged cells there. The images are comparable. And definitely if we use a frame method, I think we can count the number of cells here. So this is a famous photograph by a Scottish photographer who took 7 years and 750,000 shots to get this perfectly symmetrical diving kingfisher. So one just needs some patience. So these were the bad shots which I had. Fortunately, I could get a good shot after some 55 to 60 attempts. So these were the initial bad shots. One has to go through this to get a good shot. So what can we do with these images that we have got from a smartphone, the endothelial photographs? Can it be an alternative to a conventional specular microscopy? Maybe. So because a conventional specular microscopy requires a regular electrical supply, a separate computer with operating system, it is less accessible, and the cost is prohibitive in many medical centers. If the smartphone can provide a reasonable alternative to a conventional specular microscope, then it will be a good option because it is battery powered, it is easily accessible, it is portable and rechargeable. There is both hardware and software in one package, and therefore it's a good candidate for development of imaging technology for wide distribution. So Shrikar Manthana et al. And Devrin Toslak et al. Have done studies based on the imaging of imaging of the endothelium by smartphone. And they have used iPhone and OnePlus phones to image the endothelium using an adapter, got the images, and got their own workflow charts by editing the photographs by doing grayscale conversion, border augmentation, and sharpening of the borders. And they counted the number of cells, and they found that it was comparable with the images which were found by the specular microscopy. So there are a few limitations. It has got a steep learning curve and access to a good slit lamp with a magnification of 40x might be a limitation, and patient's data privacy as in any smartphone application. And one tip I would like to share is start photographing enlarged endothelial cells so that you don't get disappointed at the beginning of your photography. So that you can start photographing the normal endothelium. I would like to take this opportunity to thank the organizers of Kerakonnect 2021 and the respected judges who have awarded the second best prize for my endothelial photograph. Smartphone endothelial photography is difficult, but very much possible. Thank you.
Thank you. I think those pictures are really amazing. I have comments from the panelists.
Very nice, Shweta. Very nice.
Thank you, sir.
Probably you'll also need a very high-end slit lamp with 40x, or you have tried it on Indian slit lamps or a little bit.
I've
what
tried
slit
with,
lamp? Yeah.
I've tried with Carl Zeiss and Topcon. Sir. The other slit lamps, I don't have access for 40x magnification. So I've tried with 25x magnification also. But we can view the endothelium, but photographing is difficult. 40x is a must.
Somebody has suggested you can use a Zeiss YAG machine. That has step changer magnification.
Yeah. Yes.
Yeah, but to take a really cooperative patient, and both patient from the your patient and your doctor as well, because even a little bit of movement will result in artifacts, and not really easy to even to view the endothelium in slit lamp examination using 40x. Sometimes you really need to be very, you have to examine very carefully, keeping the illumination and the observation,
Yes.
the eyepiece in a particular axis. Photographing, it's an option, but I think, you sometimes have to take into account the how practical it would be given the kind of patients you have, whether you can apply in all cases.
Yes,
I
sir,
think
definitely.
But it's
previously we
good that
also
you
had
have shown that
some,
it can be done. So it's
yeah,
not that
yeah.
it's impossible.
We used to have some lenses also which you could put on the patient's eye and then try to see specular reflection better. I think long back even Venu used to make some lenses, although I never found them working, but probably they magnify and can use them.
Correct. And
use of an adapter makes it very easy, sir, because initially I tried clicking manually only because and it took a lot of time and effort. But as with the use of an adapter, it is definitely easier.
I guess all such kind of thing as a proof of concept will encourage people to develop software for the analysis and those things. So, I mean, you showed that, yes, you can capture with the regular phone. Somebody would come up with just an image analysis that, you know what, with this thing on your phone, maybe you can get a specular count, and this is not difficult. So very, very nice. I think one more thing which we all have to agree upon, that sometime in India, we get into too much of jugaad for everything. We don't want to spend, whether it's a software or everything. We want free software. Is it available? Like, I mean, Pranesh was talking about this thing that you save everything on Gcam or so we would think, what if my G drive gets full? I mean, we don't consider that, yeah, we can buy extra storage. And so I think we all need to spend a little more on these things wherever we can. We need to spend more money.
We'll go to the next segment of our Kerakonnect today, which is on videography. And Mr. Sanjay is going to tell us, on how do we connect our microscope to our recording system and what are the various requirements in between, which are the expensive ones and which are the jugaad ones, which we also, as Himanshu mentioned, have in our armamentarium. So I'll welcome Mr. Sanjay to speak on that topic.
Very good evening to all the panelists and the doctors. I'll just start my slide. I would like to thank the Cornea Society of India and Dr. Nikhil Gokhale for giving me an opportunity to speak on this topic of digitalization and hardware essentials. Without taking much of your time, we'll start with the presentation. Microscopes and slit lamps play a very important role in any ophthalmologist practice. By digitalizing these equipment, you can achieve many things. For example, record cases, photographs, do presentations, explain detail to patients, medical, legal. Then importantly, you can learn new techniques. You can share your techniques to present your techniques in conferences, etc., etc. Quickly going to the next point. These are the basic requirements. I will just show with my cursor. Beam splitter, C-mount, camera, a recorder, cables, and screen. Now this part, which comes in between your the patient view, the light which comes here is divided by the beam splitter. Now this beam splitter will split the light which will go in the eyepiece and it will go into the C-mount. and then it will captured by this camera. Now, this beam splitters are available in ratios of 50-50 or 80-20. Now, with your new age cameras, which are HD cameras, 4K cameras, high resolution cameras, you need beam splitter which are giving you very bare minimum light. So 80-20 serve well. So in 80% of light will be to the doctor and 20% would be for the camera. Going to the next slide. Now beam splitters are available in market are Zeiss type and Leica type. Now these are two different type of microscopes, but the Zeiss type will fit in for different camera, different microscopes. Like it will fit in for your Topcon, it will fit in for your molar by just connecting some rings. The original cost of these beam splitters ranges from 2 lakh to 2.5 lakhs from the parent company. If you buy an American one, the TTI company, like what Dr. Rajesh said, it is available for half the price and it works equally well. And then you have the Chinese ones, which is at 1/3 the cost. Unfortunately, the Indian quality of beam splitters are not that good because the light coming to the microscope is cut to a bigger extent compared to any imported beam splitters. Let us move to the next slide. The C mount. The C mount is not as important as the beam splitter. The beam splitter will come in your way when you're seeing through the light, so it will cut your light. The C mount will absolutely give you the quality of the images captured by the camera. So the C mount will be two types basically. A would be your Zeiss type and B would be for your DSLR cameras. Now, both of these, if you buy from the original company, the cost would be about 2.5 to 3 lakhs. However, equivalent of TTI would be again half the cost and Chinese would be 1/3 the cost. In this, the C mount from an Indian market, which is relatively cheaper, would be, but again, you need to do a trial and error. You have to take demos and see the quality of the picture which is available. Nowadays, the Indian microscopes with LED evolution, you can find that the C mount works well with an LED also. The cameras which are available in market are DSLR cameras. Now these DSLR cameras are from various companies, branded companies like Canon, Sony, Nikon, and they are the high end of these cameras you can use for 4K recordings also. Now, depending on the model of the camera, you can use 4K recording. But then the question is, are you recording 4K in that? And plus you're displaying 4K. So very rarely people are doing that. The next type of camera is your HD camera. Now these HD cameras are high definition cameras with a progressive sensors. These cameras are excellent for anterior segment and reasonably good for posterior segment. If you buy an industrial make for these cameras, or the one used in industries, the cost is about 30,000. But the medical grade ones are for about 1.5 lakhs, the Korean ones. And if you go to an expensive brand, which is like Sony, it is about 8 lakhs. So as I said, the Korean ones work well for your anterior segment and reasonably good for posterior segment. Your 4K cameras, only two companies, Sony and Ikagami. Their price range starts from 13 to 18 lakh of rupees, which are quite expensive. In 4Ks, I would like to say that the market is still not ready for 4K recorders. Now, these 4K cameras, you will find the recorders are equally expensive as your camera. So anything goes wrong with your recorder, you have to spend 50% of the amount. Inbuilt cameras. Inbuilt cameras are the ones which are in the beam splitter itself. But there you will be compromising on the quality of your vision, because you will find that there will be a mirror which would be coming in your way, though it will not be affecting, but then there will be light cut off through it. Then your phone cameras. You have various companies which have a phone adapter made, and you can use your phones for recording 4K cameras. Again, the 4K cameras, as rightly pointed out, the phone has to be near the sterile area. So anything you want to do with your recording, start, off, on, zoom, anything, or you want to see, then you are near a very sterile area, which is a risky affair. Recorders are very easily available on Amazon or any website. Evermedia recorders, full HD recorders, they are excellent recorders. They are very economical. They do recording on MP4 format, and there is no need for converting or editing of your videos. Convenience of using it through a remote. The cables are of 4K quality HD cables of MX company. They work very well. So instead of going for any Chinese cables, Indian cables are far more superior than Chinese. So as per my experience, what I have seen, that beam splitter is either from an original company, from the company from where you buy the microscope. It could be Leica, it could be Zeiss, Topcon, or any company, or even for matter of fact, Apaswamy. Apaswamy also has made good LED microscopes. Recently, I have supplied to one doctor in Apaswamy he has fitted the camera on Apaswamy microscope, and he is very much satisfied with the beam splitter, Indian beam splitter. So because the microscope is LED, so beam splitter originally from the company from where you buy the microscope, C-mount, good quality Chinese would work very well. Camera, high definition camera, which works excellent on anterior segment and fairly good for posterior segment. And recorder, Evermedia is what I recommend. Thank you very much, Dr. Nikhil Gokhale, for giving me this opportunity to present this. Thank you, sir.
Thank you. I think now we are very clear how the connections are and what are the basic requirements for connecting our microscope to the recording system. Any comments, then we can take at this. So maybe we'll discuss ahead. We can look at how do we do video recording with full HD or with 4K recorders using an SLR camera. And Dr. Satish Sheth will probably shed some light on how we should be doing. So I'll invite him to speak now. Dr. Satish, you're there? Yeah.
Hello. Can you hear me?
Yeah.
Yeah. Can I start sharing my slides?
Yes, please.
Oh. Hello. At the outset, I wish to thank the Cornell Society of India and Dr. Nikhil Gokhale, Dr. Paras Mehta and Dr. Paras Ben Mehta, who have been very much instrumental in getting me onto this particular program. And it is so nice to know that the Cornell Society of India has got a head office in Bengaluru, Nama Bengaluru. At the outset, again, I would like to say that the ability to capture and share our surgical skills with highest clarity at an affordable cost is possible due to today's technological advances. 4K videos, the resolution of the pixel, and then pixel by pixel we mean that it is picture element. Okay, that's a short form. It is pixel, and the 4K is nothing but the resolution of pixel of 4000 in horizontal and 2000 in vertical approximately. And Dr. Sanjay Anand has made my job much easier because of his presentation on C-mount and DSLR based cameras. So this is my financial disclosure. So I became an accidental entrepreneur by trying to find the solutions for myself for low cost recording systems. And now,
sir, sorry to disturb you, Satish sir. I'm not a doctor, sir. I'm a trader, sir.
Oh, I see. Okay,
but I'm dealing in all these products. But
okay, very nice, very nice. So it was written as Dr. Sanjay Anand. So I presume that you are an ophthalmologist. Okay. So this was the article which we had published in the Moscow in 2019, Nagpur. So I give all the due credit to my friend and my junior at Minto Eye Hospital, Bangalore, Dr. Ashish Sapkal from Nagpur. And see, there are a lot of articles that have been published in the PubMed journals also as to use and how to validate the mirrorless digital cameras for say surgical recording in ophthalmology and as well in other branches or other specialties of medicine, even dentistry too. So all this happened when I visited the American Academy of Ophthalmology in 2016. So in one of these stalls, when I went there, I happened to see this particular Panasonic 4K C-mount based camera, which was costing 10,000 US dollars. So I knew that this is not the solution for me back in India. So I went on to buy 4K DSLR, the cheapest Panasonic DSLR. And I knew that the Panasonic 4K system of a C-mount and a 4K DSLR would have the same output. So once I came back, so I started working on how to get the focal length for this particular DSLR. And even though there were some Indian vendors who were doing that, probably I wasn't really happy because they were also charging the prices were a bit high. So I worked up my own way and I could get the focal length of the DSLR. And that's how I approached an optical industry. And that's when we got the first optics done. And the first DSLR adapter I sold to the past AIOS president, Dr. Quresh Maskati, and he launched it during the AIOS Cochin conference. So now I heard so many things about our Indian products and the other imported products. See, when we are spending about 2.5 to 3 lakh rupees for just one beam splitter from Zeiss. So why not we think for other alternatives with all the new encouragement that the government is giving, and India has become the Vishwa Guru now, whether it is Ukraine crisis or anything else or COVID, world is looking towards India. So YouTube is a great master. Okay, you don't have to go for any fellowship programs. You don't have to see anything. But whatever videos are recorded either by Deepak Megur or anybody for that matter, it's a treat for people to watch and learn from these YouTube videos. And we need to change for the better. So start accepting Make in India, look for the quality, and have a comparison between the existing imported beam splitters or the C-mount, either from Zeiss or from Leica. And we should look for something as to how we can become more Atmanirbhar. Okay, there are so many national startup say things going on, and I see the future of my India from Atmanirbhar Bharat than Zeiss or Germany or any other country for that matter. So what do you mean by full HD? Full HD is nothing but 1920 by 1080 pixels, and now we have moved on to Ultra HD, and that's a wow factor because the resolution and the image that you see in this quality is really, really awesome. Okay, so I'll again go back to the basics. Actually, whatever Dr. Sanjay Anand mentioned. So whenever you see a beam splitter which is written 20 or 50, so take it for granted that 20 is the reflectance, that is the amount of light that is going on to the camera sensor. And for vitreoretinal surgeries, we usually recommend 50-50 beam splitter, where it is 50 transmission and 50 reflectance. And for anter-segment recordings, you can now go for 80 transmission and 20 reflectance. But Leica beam splitter still doesn't have 80-20 beam splitter. They come with still with 70-30 beam splitter, which is still good. And the DSLR adapter is nothing but the DSLR C mount, what we call, and it replaces the conventional C mount. The present mirrorless DSLRs are very, very lightweight and they are able to perform very good video recording facilities. So they are actually a misnomer. Okay, they are not DSLRs anymore. We call them as interchangeable lens cameras or ICLs. The first one to hit the market in this mirrorless segment was the Panasonic GH4, and followed it was followed by a Sony A7S, and now they have got A7S III. And another important camera in with micro four third is Blackmagic Pocket camera. So connecting cables, that I'll just share little information about this in my next slides. And all that you need is another LCD TV in your OT and not a 4K. 4K is an ideal TV for you in your bedroom or your hall. When you record the surgeries, convert that and then view it on your 4K system. That will be fine viewing at home, but not inside the operation theater. And regarding the memory cards, so many memory cards are available across the different companies, SanDisk, Sony, okay, and of different configurations. But basically look for U3 and class 10 class of memory cards, which have got high speed recording abilities where you can even record in 4K too. And the additional accessories that you require will be a 4K video editing laptop, and it should be preferably SSD based, which is a lightweight with trackpad. And the next option is to have an external storage hard drives. I have seen people ending up, stacking external storage hard drives, which can fill even a room in a practice of over 8 or 10 years or so. And how do you assess your quality of videos? Okay, when you want your videos to be of a good quality, you need to have the ratings of the mirrorless camera. Just because it is a Sony camera, don't go end up and buy a mirrorless camera. Try to go and look for its specifications, in what form these sensors are really performing. So that's an agency called DxOMark. And what they see is basically is the ISO range, the dynamic range, and the color space. Okay, the higher the sensor ratings, the camera cost naturally increases. And the DSLR sensors are very, very economical than the charge coupled device cameras because of the cost of manufacturing. And the second thing is that DSLR cameras are basically commercial cameras and they're not the medical grade cameras. So since they're manufactured in lakhs and millions, so you definitely tend to see that the cost comes down when you buy a DSLR sensor camera than a CCD camera. So a 4K quality of video recording on a 4K Panasonic or Sony system would cost you not less than 25 lakh rupees. Okay, so this is how the DxO rankings are being provided for the cameras, and I have chosen the Sony A1, A7, and A7C. There you get to see the overall score, the portrait, the landscape, the sports, everything has been compared, and this gives you the value for money that you have to invest in your system. And don't listen to this microscope service personnel. They're very, very biased because they have been told to talk only about their company and not to promote anything third party. They give very, very poor ratings to the third party manufacturers and they want to advertise their own products. So I got several complaints from my colleagues that if I put your system on my microscope, my service engineer has told me that he would not service my armature in case if something goes wrong. You just see that this is my basic 1FR microscope where I have put 2 of my own adapters and 2 DSLR cameras, and still the armature is working perfectly fine. Because they lack the expertise to recommend the customized options because they're not interested in it, because they don't have any financial interest in that. So what the surgeon basically needs, what suits his pocket, is what is to be decided by the surgeon himself, nobody else. And here I would like to give you some advantages and disadvantages of a DSLR and a CCD. So the DSLR comes with little large sensors. So we can expect sensor size of 22 by 14.8 mm, 36 by 24 mm, 17.3 by 13 mm. All these are all the industry standards. You can just go and browse into the YouTube videos. It's a Vishwaguru. Just search for all the videos that you need you just boil down to the right camera. Otherwise, you end up kissing many a toes before you find the prince. And the higher the resolution, the higher will be the pixel number. It has got extensive dynamic range in terms of brightness and color. In terms of light sensitivity, essential in low illumination is where you would like to record surgeries, especially retinal surgeries, where you need to have like a good light sensitive camera. There I would usually recommend a Sony A7S II or A7S III because this is the camera is there on the International Space Station. The color depth, it's about 14 bits per RGB channel, and where you can actually have a simultaneous recording and display, and the DSLR can function as a single autonomous unit even without a display system because you have got an OLED monitor there. So this is the comparison to the Panasonic 4K system, which costs just about $10,000. So it has got short exposure time, and it offers a full 4K video recording. And I will tell you in my next slides as to is 4K really needed. So you have got high pixel number, separate display for image control, and you also have an option of using dummy batteries for an AC wall outlet because your batteries will run out quickly. And camera operations can happen, as I said, without PC or Mac. And you have got a huge second-hand market in DSLRs. If you've got some friend or someone traveling to US, you search on ebay.com, you tend to get the cameras a lot at almost 1/3 the price, which have been used for just about 6 months or 1 year or so. And the disadvantages of the DSLR, I would say that there are not many software bundles available, and there is no interoperability with motorized microscopes. And this is more of technical system terminologies. It's not going to be of much help to our colleagues who are watching the thing now. And then I would like to suggest about the HDMI cables. So Dr. Sanjay Anand also mentioned that the Indian cables are very, very good compared to the Chinese ones. But I would like to boil down on to the finer aspects of these HDMI cables, what you should go for. One is you go for, whenever you see for an HDMI cable, you see as to what are the specifications. One is high speed with Ethernet, high speed without Ethernet, standard speed with Ethernet, and standard speed without Ethernet. And HDMI 1.4 connectors, they do support 4K system, but not at a higher frame rate. They work at a frame rate of about 30 frames per second. If you at all you are planning to record in 4K at a higher frame rate, say about 60 FPS or at 120 FPS, then opt for HDMI 2, that's called Ultra HD, or the latest ones that are available in the market are HDMI 2.1, where you can record at 4K at 120 FPS or 8K at 60 FPS. So for the new users, the problem is that if you start recording in 4K, your data gets filled up very quickly and you will end up buying more external hard disks. And the cost of the hard drives is an additional cost. And it is very, very difficult to operate on the old computers. Even if you have got an old computer which does not have an SSD drive, even if they have got a large space, it is not going to be of much help for you because all that you need is a good SS drive facility now. And now I'll just boil down to these two cameras which I basically recommended earlier. Now the GH4 has moved on to the next version called GH5. And you have got various picture profiles on the camera. You have got hundreds of permutations and combinations at your disposal, and you have to customize all this to your needs. Okay, what one surgeon finds as good for himself will not be suitable for other. So you need to just look at the basics of this photography and about these cameras. And there are so many YouTube videos available for you to teach. You don't have to go and attend any camera course or anything for that matter. YouTube, you just type the simple terms GH4 Panasonic, you just get there at your fingertips. You've got this basic profiles like standard, vivid, natural, monochrome, portrait, Cine D, Cine V. All these DSLR cameras are capable of recording surgical videos for about 30 minutes. Because of some US legislations, these cameras were made to restrict the video time for about 30 minutes. But now the present version of GH5, you can record with two card slots, and back to back, and you can record it for more than about an hour and a half or so. And there are various file formats like AVCHD, MPEG-4, movie files. You can shoot in different resolutions, and now preferably you can shoot in full HD rather than 4K. Okay, and 4K can be simultaneously recorded in some cameras, the 4K enabled cameras, whereas 4K is possible right now only on the internal say memory card, and simultaneously you can record in full HD through an external recorder. So when you want to present a 4K kind of quality in your presentations in American Academy or any of the presentations where they still do not have 4K projectors with them, you have to downgrade this 4K resolution videos to full HD, but they definitely look a little better than the full HD recording. I do agree with that. And you have to look at the bit rate. At lower bit rates, you need to prioritize on storage space and choose the frame rate, because when you are choosing the frame rate of each of these cameras, they say your shutter speed should be approximately double the frame rate that you choose. So if you are choosing 24 frames per second or 30 frames per second, they recommend that your say shutter speed should be approximately double that. That's a dictum by the photography industry. And here I'll just share with you the Panasonic, the common base. Okay, the basic function buttons are available there. Everything is at your disposal. And if at all you have got an important say image or important video to be captured, you can just go to the quick menu options where it can be set in the customized format. You have got different customized formats here. Okay, so this will consume a lot of time. I do not like to spend much time on this. We can definitely have a separate session on only these DSLR camera settings. And see, these are the custom settings there, C1, C2, C3. And I just give you actually what these custom settings are able to perform when it comes to the full HD and 4K recording. So C1 is called standard shooting, it's in 4K, where you can record at 24p at 100 Mbps. The shutter speed should be 1/50. In C2, you can record in 4K, and in slow motion, the recording mode should be 30p and 100 Mbps, and shutter speed is approximately 1/60. So this is the specifications for C31, and where you can record in 1080 at 24p and 100 Mbps. And this is another great camera. So right now it is off the market, off the shelf, and it has moved on to A7S3, which costs just a bomb. These cameras were initially costing about 1.2 to 1.4 lakhs. And now the A7S3 version is costing approximately about 3 lakhs, 2.8 or 2.9 lakhs. So it has got the best resolution in terms of 4K, and you need to have a Sony codec for that. That's XAVC there. And in full frame, it has got a crop factor. So there are certain limitations when you are using the camera to its full maximum capacity. That's the full frame. Okay, in HFR or the high frame rate, you get to have a bit rate of 100 Mbps or 60 Mbps, where the crop factor is windowed to 2.2x. And you can see this is how the full sensor camera of the A7S2, which is showing you the APS-C option as well as the full sensor option. And in a gross this thing, I just like to share as to how this field will be covered in terms when you are using this A7S2 in the full frame or in a HFR sensor crop. So you see the image on top will be seen in a 35 mm when you capture the image or the video in a full sensor. Okay, when you are using an HFR crop, it crops the image to 2.2x. You still see the image, no doubt, but your field is definitely restricted. And now I would like to give some additional fine tips out of the reviews that I got from the surgeons who are using the Sony and Panasonic for 4K recording system. So in a video recording, when you are decreasing the shutter speed, that increases the brightness. Okay, and increasing the ISO also increases the brightness, and it's a balance for both. Like where you are doing an ILM peeling, where there is less of movement, because when you are shooting a car rally or a racing car, that's where you need to have your shutter speed and should be lower. But here, since ILM peeling is a very subtle and very fine movement, so it really doesn't matter how much of say ISO or the frame rates you are going to set. So the best option is to go for an ISO around 1500 to 2000 with a shutter speed of 1/30, which is against the industry dictum. They never recommend this because they don't do surgical video recording. What they recommend is basically about the outdoor photography or outdoor videography. And for a routine vitrectomy, you need an ISO of about 800 to 1200 with a shutter speed of 1/60. And for a cataract, as low as 400 to 800 with a shutter speed by 1/50. Because as you go on increasing the ISO, it increases the noise and the image becomes more grainy. So you restrict yourself at a lower ISO and you can play around with your shutter speed by adjusting the brightness according to your needs. So shooting 4K, you need a fast computer, 4K delivery, and archiving becomes a little messy issue. You need to have some cloud space to store all your 4K videos, but it is a very good option for future proofing your videos because someday in future, this will be outdated and you may end up with 6K or 4K videos. So reframing the post editing, where large 4K frame size allows you to just a portion of the image when delivering in HD. Okay, so this is what you get ultimately when you're presenting in your conferences or your peer presentations, and you have a better HD output. I do really agree with that. So 4K will have really awesome facility, and here 4K is not needed. Okay, I would suggest now simple example that I can give is even when you have got a 4G or a 5G mobile. Okay, when you can definitely buy a 5G mobile because one fine day 5G will be a living.
So we'll just sum up quickly. Yeah.
Yes, yes. So I knew that this would happen. So I would say you need a slow computer and using APS-C lenses and slow motion, and you need to have a fast turnaround for 4K. And the future for the video recording system for our colleagues, in India, we need to have a think tank amongst our colleagues. And I would recommend to go for a seed funding either from AOS or some venture capitalists. And we need to have free booths in the conferences for the people who come with some new innovations, new technologies, trying to develop their apps. And there should be a free advisory for the protecting the intellectual property rights. And we should be accessible to have subsidy for the patents for our scenario. This is what I have been expecting from our organizations, and I always recommend this so that even Dr. Nikhil Gokhale, we can please take it up this matter through the Cornea Society of India to the AIOS and see that our colleagues are benefited out of this. So these are my acknowledgements and thank you very much. So these are the slit-lamp photographies that have been which were recorded on 4K DSLR in full HD, and this is one of the reviews I got from my friend Dr. Suven Bhattacharjee on my newest edition of the DSLR Raptor, which has got an XYZ controls, which can have your image separation and everything controlled by these controls. And he was very much instrumental in getting this device for his needs, and now we are quite happy about it. And thank you so much. Thanks for the patience here.
Thank you, sir. That was an amazing talk, a lot of innovation, and I totally agree how you have won so many awards for videos and innovations. So I think maybe because of shortage of time, let's move to Vineet, who will now tell us that once you've recorded the video, how do you handle the file and how do you move ahead? So Vineet, you can take your talk.
Yeah, so I had actually made this Word document when I took one class here for fellows on basics on video editing, video recording, and I will circulate this because it's something that I use it very frequently. There are a lot of accessory softwares that help you in actually making a video better, and it's not just the video editor, but a lot of things you need at hand more than that. So talking about different converters, like I'll be very to the point and specific as to what has worked for me and some review of basically what works on different systems. So when I use Mac, there is an amazing software called Smart Converter. It's there on Mac OS, and it's very simple, easy drop down kind of a software. And what I found it that this one is very, very versatile. It is actually pretty smart because if you see here, what it does is it will give you direct use case scenarios as to what is the final output that you want, in which particular platform you want to play your video. and you can select it accordingly, and it will kind of adjust the resolutions to that, and it will really help you. And look at it has quite a big list of formats that you can do, and I found this one very easy because the rendered video, the speed is pretty fast, and the rendered video quality is not compressed or hampered in any which way. And I found it pretty, it can also convert from QuickTime to Windows also pretty fast, and it's a very handy tool if you want to shift from devices from Mac to Windows, or from .mp4 to any other .avi, .mpeg, everything is possible. So that one, and also I found this one, especially AVI converters are not available in many newer formats, so you need a separate softwares for the same. Again, these are the options that you can download from the App Store, or for Windows you can just Google search and get. This is one more software called Movie Converter, and again it gives you a lot of options that you can choose. It's a bit complex, but might as well switch to default settings, and whatever is needed for AVI, it will do the rest for you. And this one takes a bit longer time, but it's good. What I do usually is that now if it's a bigger file, I just put it overnight, and you get a .avi file which is run on the older Windows media players, or if you want to play it on some of the older versions of Microsoft Office and PowerPoint, so where you can put it as a link. And these two work pretty well. And what I really found was interesting and useful is what has changed very recently, and that is doing all this online. And there are amazing converters online, and I would just like to share a few of them here. um, Most of them are like not just video converters, they are combined. Like you will find everything on that site. For example, I'll just show you one of my live page here. So if you see this particular page, this is one of the converters which I found pretty versatile. So these are all online converters. You need to upload your file. It can be an image, it can be a video, it can be an audio, it can be a PDF, anything. So what it does is it has everything in one go: document converters, image converters, video converters of all the formats, and it is usually pretty helpful. And what I really found is it will help you most commonly use the MOV converters for QuickTime and MP4 converters for universal playability. They are pretty good. The newer formats where we are getting video recordings from the OR are usually MP4 MPEG formats, and they are, if at all you're using a 4K recorder, problem is always about the size, and that's when it's a bit difficult when you're using online converters, where you cannot upload such a big file onto a cloud. There is a limit for these online converters, image size being somewhere around 50 MB maximum, and video converters, small videos, I think up to 200 MB or 300 MB or so. Again, you have to, once it converts, it has a limited storage space and you can download it back. But I found this pretty useful for routine day-to-day use. If you want to edit for if you have already spliced the video using an editor, taken out your clips and joined them, and then maybe you can convert it to whatever format that you want. To this, there is one solution which I found. The XN Convert software is pretty good, and it's basically an image converter software, but it also gives other facilities. But the best part is it has close to 60, 70 formats, output formats, absolutely everything that is currently covered in imaging, and It is very good. You can literally play with any format anywhere, and it can convert like loads and batches of images at a one go, not a single image. You can just take a bulk from your computer, dump it in this, and it will convert it in whichever format that you would want. One query which Dr. Nikhil had raised regarding these Nikon images, which or the DSLR images, and how to convert them. So there are two ways. One is, again, we can change the setting from saving it on the DSLR from RAW to, you can actually save it to MPEG or JPEG quality as well, and that can be done through the menu setting, and you can switch to whichever quality of image that you want to keep it in, whether a large, a medium, or a small type. All you have to do is switch from RAW to JPEG. Now this RAW format is usually .c2r kind, and this is the second way. If you have already saved it in RAW, then again there are online converters. The name of this is only online converter, and this is the link for the same. All you have to do is upload it, and it will give you anything. So another amazing thing is it does for all platforms, for Nikon raw image, Sony raw image, 2G, any other DSLR. It will give you universal solutions to the same problem. Talking about .tiff format, the images that you get from smartphones, again, .tiff converters are also available online, and I think this is one of the best platform which I found for the same. Another thing, I'll just shift back to my this document which I had created. So here what you can do is, once you have the video with you, and what you can do with it, once you have, either you can, I use the iMovie. I find it pretty good to work with. There are similar softwares available on Windows, for which I felt that Blender and OpenShot are much better softwares with similar utilities like iMovie, which are easier. And OpenShot is actually a free open source. You don't need to pay or have a subscription for the same. Blender has both versions. It has paid version also, and it's a bit more complex to use, but it is very commonly used by graphics designers, and you need to understand the language a little bit. Takes at least a week to understand all of its features, but it is pretty good. OpenShot is very easy to use. It's very similar to iMovie if you have used iMovie, and very easy to splice and join the videos together. Another important software which I feel is this particular app which I found on iPhone, and I use it very very often. This is called a voice recorder and an audio editor, and the filters that it uses and the noise cancellation algorithms are fantastic. It really is very easy to give voiceover using this software to any videos, whatever that you have saved, and it is really very easy to use. And similar one is available on Android called RecForge 2, and this one is also a very powerful tool. Very similar use case scenarios. Another, I have also added a list of a lot of common background musics that you can put for video editing, and I have put it together, which can be used. And these are all, some of them are free to download, very commonly used, very nice background tracks as well. And another thing which is also very important is the special effects and After Effects, and this can be used for any video, any format. All you need to do is and identify which After Effect you want to give, and you can actually pay for it and download them. If you have a subscription for Adobe After Effects, then it is very easy to use. If not, you can download it from Motion Nations, or there is a I'll just show you. So motion elements, yeah. So the motion elements gives you very beautiful. It's an online archive of a lot of After Effects that you can utilize overall. Also, if you have the premium subscription for Adobe Premiere Pro or Final Cut Pro, then it's the best thing that you can use. It supports a lot of formats for videos. It supports a lot of large files. And I think if you have a setup as we saw in your previous presentations for 4K video recorders, then you need something like Adobe Premiere Pro or Final Cut Pro, because to process files of 20 GB recorded in 4K and to edit them, to splice them, you need a powerful processor and you need a powerful software, for which I think I would suggest you go for this one. It's pretty expensive. Annual subscription fee is up to $280 for Adobe Premiere Pro. Final Cut Pro is still better. You get a lifetime membership for $290. So all in all, like, this is briefly what I thought. If your file size is smaller, go for online converters. You can upload it and you will be able to convert in any format that you would want. If you are offline converters, then some of the apps that I showed have really worked for me. They're pretty good. Thanks.
Thank you, Vineet. And I think he is going to be kind enough to share this file with all of us so we can circulate it to members. And then I think we can try, each of us could go through and try the various softwares and the online platforms. So I think at the end of the day, we seem to be very close to make getting the very good quality videos. And Deepak is going to now tell us on how to make them really award winning. So Deepak, next, go ahead.
I think this is the last talk of the session, and there are many award winners in the panel here, so it's sort of a little bit embarrassing that I am speaking on this. I just try to share a few of my thoughts on this, and thank you for the opportunity once again. And thank you, Satish, for suggesting this topic.
Yes.
So how to create one? I think there is there a secret? I think there is one real secret, and that is luck. I think you should be really lucky, because having participated in many competitions, I realized that the luck does play an important part here. Let us go through some of the parameters which are being given for judging some of the films. And this is I've downloaded from the ESCRS website. And these are the standard categories in which the judges are going to give points. And then the overall video points would be then taken into account. So basically what it sums
Doctor,
is...
Sorry to interrupt. Can you reshare your presentation, Doctor? There is some background notification which are on.
My notifications are off actually. Okay, I'll do
yes,
that once
sir.
again.
Yeah, you can. I think the chat notification is on. You can stop that. And instead of sharing the screen, share the presentation.
Chat, you want me to off it or something?
There's a notification which is hiding your presentation, Doctor.
I think that's the screen, the gallery is hiding. So Deepak, if you can just move the gallery from your screen somewhere.
Here, okay. Now?
Yeah, one, then other.
Yes.
Yeah, that's
Yeah.
one. That no, the next one.
Okay, I'll just play it now.
No,
Is it okay?
no. So there's below one. There's another black
Patch is
notification patch.
Yeah,
Which is
that one. That's
Yes,
the
sir.
corner one. That is a huge one.
I'll just stop share. And let me share.
Instead of share screen, you can do a share presentation when you click on the share screen button.
Is it okay now?
No, sir. It is increased now.
It's basically your
Now?
yeah, those things. Yeah, you can move that, and there is one more down also. Yeah, you can move it a little up. Yeah, that one.
Is it okay now?
I think we can go ahead because there's one corner one which is not moving.
Yeah, that is not
Yes.
moving. The corner one. No, I don't. I think you don't have anything there on that corner. You can proceed.
Okay.
Yeah, one more got added now again.
One more got added.
Yeah, yeah. At the bottom, it has taken
I think it's okay. We can go at.
I think you just ignore it.
Sure, sure. Yeah, sure. Let's go ahead.
Yeah, I'm sorry for that. I'm not able to figure out what it is. So these are the criteria in which the content of the film is being judged here. And there are few variations, like, American Society of Retina, they prefer more fun element, and in some conferences, they prefer more serious stuff. And I think that is, you have to tailor your presentation based on that. Well, the typical characters of an award winning is obviously the core message. And if something new is being presented, some innovation is there, definitely it is probably the biggest USP of the film. So that is the USP. But because this is a video competition, the quality of the film does play an important role here. And we can't emphasize that audio is as important as the video itself. And obviously, even if you have a great content, great innovation, the storytelling has to be interesting and it has to be engaging. Because even a great message, if the storytelling is very boring, you can lose out the most important message here, and it need not win the award. So how do we begin? I think the most critical step always is going to be the script. First, you need to write the script. You have to write out how the movie is going to pan out. Then you start shooting it, or if you already have shot, then try to arrange it. Last would be the edit part. Edit is going to be last. First thing would always be to write the script, and you want to choose, like, first write a small synopsis highlighting the most important aspect of your film. Like, what is the one thing which I want to convey in this film? That we should be very clear about. And the synopsis is one. And you have to always think, if I want to tell the story in one line, what is that message is going to be? So begin with this point, and this is probably the most important. And work your script around this one goal. That is probably the most important. And by the end of the film, you should be able to convince the viewer about your main intention or goal. Typically, when we write a script, it's usually as a 3-act setup. You have a 3-act setup. The screenplay is something like this. There are 3 acts. The first is you want to set up, you want to introduce the problem. What is the problem you're going to address? And then the second is the main body of the film. That is the confrontation. You're going to solve this problem, and what are the hindrances you're going to get, and how you're going to work around it. And finally, we are going to resolve this issue. So we have the screenplay setup in 3 parts. You have a problem, then you're going to show them how you're going to deal with it. And lastly, the climax is the resolution, where you're giving them the methodology by which you're going to solve this problem. This is a typical setup on which you have to write the script. The common mistakes while developing the script is don't waste much time, beating around the bush. Suppose, for example, you don't have to, go back on backstories, don't beat around the bush, be precise and to the point. For example, your movie is going to be strategies to minimize Rex's runoff and intermittent cataracts. Don't waste time on introducing different types of mature cataracts. Second is always avoid unnecessary subplots, because when you want to tell a message, so many things are coming into head that I want to tell this also, that also, but avoid this into which are not so important territories, because ultimately, for example, you in the same situation, don't waste time on management strategies of a Morgagnian cataract. Both are white cataracts. So avoid these unnecessary subplots, because ultimately timing is very critical. We've got only 8 minutes or 6 minutes to convey a message, and the message has to be, conveyed in the most strongest possible way, and you can't waste time on these unnecessary subplots. So razor sharp focus on the main message. That should be the key. You cannot allow your story to wander and in unnecessary areas. And obviously, when you've done the scripting part, then the video has again got I would say 3 important parts here: the introduction part, the body part, and finally the climax part. The introduction, when you're introducing, it's just like when you're introducing a movie hero. You have to have the best footage here of all your collection of films which you are going to use in this particular video. Use the best clippings and they have to be highly impactful, because the judges are going to judge hundreds of films. You have to grasp attention the first few seconds when the movie starts. So use your best footage as soon as you start the video. and you want to create that, show the problem which you're going to solve using this best footage. It has to be highly impactful. Then the body or the central part, you can slow down because now we have caught hold the attention of the judges. Now you can slow down and you can share your study details. You show a lot of case series. And important to have a lot of material inside, like a lot of footage of real cases rather than showing animations and other things, because that would convince the judges that what is you are dealt with the real stuff. And again, the summary or the climax, again, you go back to your best footage. Again, the summary or the climax has to be, highly impactful. Choose the right sentences, right vocabulary to describe this, whatever resolution you have found for the problem. So the introduction, the climax, you have to be very highly impactful. And because if you want to make an impactful video, I think you need to record every case, be conscious of recording the best possible quality, then choose the most relevant clips. Because when you want to tell a story, because when you record 100 cases, only 10 cases will be shot in the best possible way. So that's the reason why you have to be recording every case, because you never know when you get that useful clip, one useful clip. And obviously, always try to record and store pre and post-operative pictures and videos, because they always carry a lot of importance and they carry a lot of impact. And always make sure that you have a couple of hero shots. When you're written a script, always, give it some time, maybe 2-3 months for you to capture one hero shot, because that is going to be your highlight shot, which the viewers are going to remember even after the film is over. Like this is the shot from, Bahubali, where everybody remembers this particular shot apart from many shots. But this is one thing which you need to always focus on. And I just want to show one clip where, of my film, which was collected over many years. Like it was a spontaneous rupture of posterior capsule. This is an extremely rare thing. And this is a spontaneous rupture of posterior capsule, which many of us would not have seen. And I could gather about 4 cases among 10,000 cases. And if you can have collections of such cases, this is only possible if you record videos of every case in the highest possible quality and store them. So it requires some effort, but it really is worthwhile.
Because I think your slide is hung up.
I think, yeah. Okay. And moving on to the audio part of it, which is often more ignored, and especially for the novices who ignore this part, it probably is more important than the video part, because your commentary is always going on. And if it is not impressive to the judges, they just don't give enough importance for this, and they just move on to the next video itself. So audio is probably more important than the video. Just focus on having the best mic setup and using the best recording software to record your audio, and also check it whether it is good enough to be heard. And background music should just be used to convey an emotion and should never be a distraction. Most often I've seen that, the vocabulary or the voiceover is going to be very less audible, whereas the background score itself will be more seen. So better to avoid background score whenever there is a voiceover. Use background music only when you don't have any voiceover to tell. And avoid, large gaps of videos where you don't have voiceovers, because that is not going to, again, engage the viewers. And obviously, before submitting, play it in different computers, check the video resolution, audio and compatibility, because you shouldn't get stuck once you already submitted. So once you're done all of this, then only you should submit. And I conclude by saying that, again, wishing you all the best of luck, because that is probably the most important ingredient to win any award. That's it. Thank you for the attention.
Thank you. That was a excellent, I think, message. Probably, I think that's the most important. I think we all make videos, but we don't realize what are the important components that we need to look into when we make a video. And I admit, I think all of us need this particular message to go in when we are making and editing a video. Probably more important than the editing part. I think we spend most energy editing it, and then the rest of the components are not there. I think that's really a very good talk. Any comments from our faculty, or we are already fairly late, but we could have some final comments and then close.
It's wonderful session, Nikhil. I think it's overload of knowledge. Nobody's asking question, but I guess in our souvenir we can print a few of these things so that people can sort of remember, or on a website if we can have these things so people can remember, because we may not have taken notes for everything, and each and every topic was really nice and welcome. Thank you.
Yeah. So I thank all of the panelists and the faculty who are here. I thank the Cornea Society office for making everything run so smoothly, and all the audience who have been there with us till the end today here on this Zoom platform, on the YouTube as well as the Facebook platform. And most of all, I think I must thank all the speakers who made it a really wonderful program, and I'm sure all of us have definitely benefited, and all the youngsters who are going to go into practice will find these very beneficial. And all these Kerakonnect programs are there on the CSI website, on the links are there on YouTube, and we can all go back there and try to pick up things that we missed while we are on the program. So I thank all faculty, all speakers, and have a great evening ahead. Thank you.
Thank you. Thank you, everybody.
Thank you, sir. That was great.
Thank you, sir.
Thank you. So just let us know when we are off live.
Sure, sir.